Welcome, everyone. Thank you so much for joining us. We are going to get started here shortly. Uh, we just want to welcome you to this session. This is our final session of this Health Center Emergency Preparedness. Please feel free to, in the chat, share your name, where you're joining us from, and an emoji that expresses how you're feeling today. Please, thank you. So we want to welcome everyone to session 4 of this series. This is the final session of the Health Center Preparedness Response Forum that will focus on workforce and community support. We are glad that you are joining us, and we appreciate your presence and engagement. So let's get started. Next slide, please. So a few housekeeping items. Many of you are familiar with Zoom. So today's presentation in the web is in a webinar format, which means that all of our cameras and audio are turned off. We encourage participation in the chat and the Q&A box, and want to remind you of the keyboard shortcuts for each function, as well as the option to turn on closed captions. For any other access needs, please message Ivy in the chat for those needs. I will be reading from script. So slides will also be shared in the chat for those of you who want to follow along. We will release a transcript with the recording of this session within a week. Next slide, please. So this forum is a collaboration between 11 different national training and technical assistant partners, or NTTAPs. NTTAPs provide free training and technical assistance to support health centers in a manner that increases patient safety and health outcomes to effectively serve priority population. To learn more about the NTTAPs and the individual priority populations they serve, please visit the link that will be shared in the chat. Next slide, please. So we will be your moderators for today's session. My name is Monica Garcia, and I use she, her, ella pronouns. I am a health strategy specialist with MHP Salud, and I'm co-facilitating this session with my NTAP partner, Matt.
Hi, my name is Matt Beyerschmidt. I am the Senior Program Manager for the National Nurse-Led Care Consortium's NTAP, and you'll be hearing more from me later on in the session. I'll be doing the Q&A and the Mentimeter. But thank you for joining us.
Thank you, Matt. Next slide. In our session today, our presenters will be focusing on workforce capacity and staff resilience in disaster preparedness. We will hear from our guest speakers, Amy Moncion and Jillian Bird, who will present on maximizing community health workers and team readiness in emergency preparedness. A Q&A will follow with an audience engagement through Mentimeter to gauge the current state of preparedness at your health centers. Lastly, we will also expand on resources and workforce capacity and disaster preparedness and response, and close with an evaluation. Next slide. Our guest speakers today are Amy Moncion and Jillian Bird. Amy Moncion is a seasoned licensed clinical social worker and qualified supervisor based in Florida. She brings nearly 2 decades of experience serving underserved and marginalized communities. She holds a NSAW Academy of Certified Social Workers credential and is a certified community health worker as well. Amy oversees the Florida Community Health Worker Training Apprenticeship Program as the Community Liaison Director with MHP Salud. She is a graduate of the University of Central Florida School of Social Work and also serves as an undergrad adjunct instructor. Jillian Bird is a master's prepared registered nurse who currently serves as the Director of Training and Technical Assistance and as a Program Director of Nursing Professional Development Program at the National Nurse-Led Care Consortium. Jillian works with national partners, community stakeholders, and federal funders to optimize resources and leverage opportunities on behalf of health centers, PCAs, HCCNs, and other technical assistance recipients. Her background is in community nursing with a focus on maternal addiction, supporting parenting and pregnant people with substance use disorder. She's an advocate for nursing workforce and community-based nursing, and especially optimized nurse-led care in the health center space. She received a BSN and an MSN in nursing from Thomas Jefferson University in Philadelphia. So I'll now pass it on to our presentation to our speakers. Thank you.
Hi, good afternoon, everyone. As Monica said, I'm Amy Moncion, and I am the Community Liaison Director with MHP Salud. I'm very honored to be here to talk about community health workers and how we can maximize them in our disaster preparedness and response. Next slide. After my discussion with you all today, I hope that you will have an understanding and be able to maximize the role of a community health worker in your disaster preparedness in healthcare and community-based settings, as well as an understanding of how a community health worker certification and apprenticeship program offers new approaches to disaster response preparedness training. Next slide. I wanted to start our conversation today with just giving an overview about what the national preparedness goals are. And what I find that is so interesting about the definition and how it's defined is that the whole community is addressed within this goal. And community health workers are at the center of what I believe and what our organization at MHP Salud believes can really connect those individuals in underrepresented, marginalized communities and ensure their safety when these types of natural disasters occur. Additionally, when we're looking at how community health workers have been utilized in the past several years, especially with the COVID-19 response, they have been deployed into areas that aren't necessarily equipped to handle the need, and they go in and are able to connect and bridge those communities to our healthcare centers, to our community-based organizations, to the individuals that are viewed as authorities within their communities and feel safe and secure in having their needs met. When we look at what is laid out within the National Preparedness Goal, it describes 5 mission areas: prevention, protection, mitigation, response, and recovery. And in addition, it looks at 32 activities called the core capabilities. And when we go into the next slide, it's really going to highlight how community health workers are at the core of this response goal. Next slide. So as you can see, where are community health workers supporting this goal? In 5 of these areas, they are supporting it. Additionally, when we look at the areas that they aid in, public information and warning, physical protective measures, community resilience, which I know Ms. Jillian's going to jump into about your healthcare centers, but they're at the core of creating healthy communities. Essentially looking at long-term vulnerability reduction. Community health workers are essential to meeting those clients where they're at and addressing those needs in real time, connecting them to services and supports, and providing them the necessary information to make good choices and live a healthier life. Additionally, when we look at kind of the higher order pieces, they are integral to environmental responses, health and safety, transportation, getting clients in and out of certain areas. In Florida specifically, we have had stories from our community health workers where they have described going in and helping to remove trees that have fallen, going in and helping in communities where clients are barricaded in their homes because of floodwaters and getting them out and responding in those situations. Again, we typically think of them within those health and social services aspects and even in housing. So community health workers really are essential and at the core of what we do when we're talking about preparedness within our healthcare centers, our community-based organizations, our communities, to really ensure that there's a holistic approach occurring. Next slide. This is just the definition that when we look at the role of a CHW as the link between the community they serve and the wider health and human services infrastructure has become vital in the recent history in addressing public health crisis. It has also become clear that CHWs are more effective when they have appropriate training. The reason this is so important is when we start to talk about how are we supporting our community health workers within our organizational structures. It is not enough to send community health workers out with just their lived experience. That is the foundation of what they do, but they need to have a practical classroom-based support as well as professional mentoring to ensure that they are able to not only provide the best capable services to their clients, but also to ensure that they are protecting themselves from secondary trauma, from burnout, because the stories and the experiences that they are being invited to come into their clients' lives, it's becoming more and more apparent that in order for them to be successful and for them to have sustainability within the workforce, training needs to be at the center of how we approach developing community health workers within our response. Next slide. So this is some data related to how community health workers were deployed and also how training has impacted their abilities to be successful. Taking specific note to COVID-specific training, they were 6 times more likely to advise on COVID and provide services. So again, by having the knowledge, having the classroom-based information, they're able to better articulate with their clients about the necessity for accessing services. Additionally, the training needs to be specific in the types of activities that they're taking. One of the areas that I think is really critical in how we approach community health workers in preparing them for disaster responses is them understanding what their key role is and what their task is, and utilizing a framework that is clear so that those boundaries can be firmly established, not only for their client safety, but also for theirs. Additionally, the ability to collaborate with community health workers within not only their respective agencies, but the agencies that provide help actually increases the capacity. And in a few slides into this presentation, we're going to talk about how our MHP Salud Florida CHW training and apprenticeship program is cultivating cross-sector relationships between healthcare centers, community-based organizations, through our employer and our field placement site organizations that are supporting our CHW trainees. Next slide. This is a general overview of the Florida CHW training and apprenticeship program. It is a 3-year, $3 million grant. And we are tasked with training 200 CHWs in the state of Florida. We're going to share some outcomes shortly, but overall, the way that we have approached our practical training in the classroom base is to provide 62 hours of virtual training with a trainer, a live trainer. We do not utilize asynchronous, although we do provide our trainees with opportunities if they miss a class to be able to review the recordings and continue to participate. So we have found ways to address potential barriers that may come up, life expectancy, things that may occur that may prevent them from showing up to a live class. Additionally, as I stated, we have a variety of field placement sites that provide on-the-job experience. So once they complete their classroom training, they go into a field placement and complete about 500 hours of on-the-job training within a CHW role. Those organizations are medical clinical settings to health education and outreach, to mental health services, community resources. And they also receive 20 hours of direct supervision at a minimum in the 5 domains that Florida requires. And the 5 domains in Florida are taken from the C3 and are primarily focused in education, communication, advocacy, health foundations, and professional responsibilities. Additionally, we support our trainees through the certification process. We are lucky enough to be able to not only provide the training experience for free, but we also support and fund the state certification exam application as well as the proctoring fees. Additionally, one of the ways that we have been able to provide comprehensive support is through our stipends. So those individuals that are unemployed and seeking to get into the field, or those individuals that have less than 2 years of experience, have access to an additional stipend during the course of the program. Additionally, we have a community engagement specialist who provides case management, certification support, and job placement support up to 12 months within the program if they're in the traditional model. For those that complete the initial model, there is an opportunity for employers to come on as a participating organization as an apprenticeship employer. And with this situation or this program, employers are able to identify those CHWs that would meet criteria under the new definition as incumbent workers and refer them for expanded training. And so a apprentice would obtain 144 hours of virtual and classroom training. They would do an additional 2,000. We still support them through the state certification, but in addition to that state certification, upon completion of their apprenticeship, they would be awarded a National Department of Labor certificate of completion as a community health worker. And that certification is actually portable across all states. It does not equate to the same thing as a state licensure or registration, but it is a national credential that amplifies the profession and their knowledge base as a community health worker. And in addition, they receive wraparound services. Our registered apprenticeship program is approximately 12 to 18 months, depending upon how the community health worker trainee is progressing through the program. And that is a mutual support that occurs between MHB Salud and the employer. Next slide. I wanted to share the quote from one of our trainees who not only recently completed their training hours, but has also obtained employment. And DeJuan shared with our communications department, as well as with the CHUTIP team, that the training CHWs come in with from MHB Salud is invaluable. We are passionate. The training program lit a fire under me. This is a transformational experience. The training prepares you to hit the ground running. We come in fully equipped, know what to expect, and we have a mentor. We come with a built-in support system and experienced CHWs behind us. You're not just getting us, you're getting the entire MHP Salud team behind you. And that really highlights what the apprenticeship program does. It is an opportunity for communities to come together, organizations that are supporting underrepresented, underserved areas within your state. The employer is not doing it alone. And when we talk about preparedness and we talk about response, that is really at the core of how you build strong teams, having a foundation around them. And as an apprenticeship a sponsor, that is really the role that we take on, not only with our trainees, but also with the organizations that are employing them or having them on site for on-the-job experience. Next slide. These are just some demographics of the population that we're serving. As you can see, numbers. Vast majority of our trainees are females, but as you can see with the number of marginalized communities that are represented, 63 of our trainees identify as Black or African American, 41 identify as multiracial. Our identification of Hispanic Latino is at about 43% within our demographics. And then the average age is 40. And I think that is a really important number to keep in mind when we talk about people as they're reentering the workforce, how our workforce makeup looks. And really, this goes back to how are CHWs utilized for their knowledge of their communities and really bringing them to the table to come up with those solutions that I think are critical when we're talking about how we respond to the community in those situations of natural disasters and events. Next slide. So going in a little bit deeper as to how we support our employers and our field placement sites. The very first piece is our monthly group technical assistance sessions. And within those sessions, it's not only an opportunity for us as a program to update our participating providers on what's happening within the program, it's also an opportunity for our employers and our field placement sites to get to know one another. We are serving the entire state of Florida. So we have organizations as far north as the Panhandle and as far south as Miami and below. And so it's really an opportunity when you talk about a state like Florida that can have a hurricane in one area, a flood in another, have devastating winds in the Panhandle, understanding what those community resources are, and also being able to kind of share their own experiences with each other. We have seen through this group the connections that have been made when they're offline, and really being able to share their expertise with each other, as well as leverage the available resources that each one may have in their respective areas. Additionally, we provide on-demand technical assistance sessions. I like to say that we are a concierge to our field placements and our apprenticeship employers. Whatever they need, we are there to support them, because by supporting them, that by extension is supporting the CHW workforce. The other piece that is extremely critical, I think, to creating environments where CHWs are supported on all fronts is our lead CHW supervisory training. So not only do we have a frontline training program, we also will be offering to our providers our supervisory training, so that we can really hone in on the nuances and the core skills that are needed to support these frontline staff in these high stress, high crisis situations that they may be finding themselves in. Again, the way that we have cultivated this really unique group of healthcare centers, community-based organizations, and just the overall communication flow that we have had in looking at how they respond in their communities, we have a better understanding of just how different each area of Florida really is. And also understanding that we are better together when we are supporting each other in our efforts to respond to our communities. Leveraging our partnerships become key, and that communication really becomes integral to being successful and having great outcomes. Next slide. This is just a reach of where we are within the state. As you can see, the darker the green, the more field placement sites that we have. And then the map to the right is really looking at where we have established apprenticeship sites. And as you can see, those lower three areas service rural populations that oftentimes have been critically hit within our state from devastating natural disasters. And so we're really excited about this opportunity with these organizations to be able to provide them with the resources and the coaching so that they can have a sustainable workforce that knows their community and is able to have longevity within it. Next slide. And these are just some of the outcomes that we have had as our program. We initially kicked off our first training cohort in March of 2023. And as of March 14th of this year, we've trained 116 individuals within the training curriculum. And of that population, 92% of our trainees reside or work in an underserved or rural area. One of the reasons I think our retention rate has been so high within the training program has been because of the investment, not only that MHP Salud has taken in terms of the case management calls, the on-demand technical assistance. It's really because we're touching both ends. We're touching the employers and we're setting them up for success, and we're really focused on setting up the trainee for success. One of the ways that my community engagement specialist really supports this aspect is around doing on-site visits with the trainees and going through those core competencies that are necessary to be successful. And so we're very, very proud of the retention rate that we have had. 80% of our new trainees are either active or have completed a field placement, and 60% have obtained employment within 3 months. We have been very fortunate in the respects that many of our field placement sites have hired the trainees that have gone through the training program. And so when we talk about creating community, we talk about workforce sustainability, the fact that they are able to go in, utilize their classroom skills, and become part of the team that they have gotten their training from, it's just a really beautiful opportunity to see this type of grassroots support go and play. And I think when we talk about how community health workers are that bridge, it really is a testament to them demonstrating that connectiveness with their community. The other piece is that we have identified 10 CHWs that will be going in to our registered apprenticeship program, which will be starting in June. So we will be going into providing more in-depth curricula around natural disasters and really seeing how we can continue support in that process. Next slide. So just to recap, when we talk about national preparedness goals, CHWs work in 4 of the 5 mission areas. It's also very important to note that in order to have a prepared team, especially when we're utilizing community health workers, them having appropriate and effective training is critical and key. And really highlighting how our training and curricula, our training and apprenticeship program has really supported not only the trainees, but really the employers to having a sustainable workforce. And that is the end of my presentation. Jillian?
Thank you, Amy. And just wanted to thank all of you that are joining us today. It's really great to see such high numbers of participants today in the webinar. We're just going to continue on a little bit of a similar vein of discussion from Amy's presentation about preparation of the workforce, kind of focusing a little bit of team readiness within the health center staff themselves. So wanted to just bring some attention to a publication that the National Nurse-Led Care Consortium released in September of 2022, kind of directly in response, of course, to the massive emergency response that was impacting our country and health centers in particular. And what we began to explore was how can staff really weather the demands of functioning within an emergency, especially one as long as COVID, and feel confident in their response, and health centers becoming very much integrated into that community, as Amy was referring to, that it's really this community response that is required. So just wanted to give a little brief introduction to care team readiness, and we will look at how this all hazards emergency preparedness and response competencies for health center staff can support health center preparedness and response. So of course, I think many of you know that, regarding emergency preparedness, health centers must meet regulatory requirements and expectations. It is a non-negotiable. And this process of readiness results in health centers being able to identify the ways in which they can provide emergency treatment for their patients and more broadly to their communities beyond what they might do on a day-to-day basis. The associated capabilities like management, clinical, logistical, all those things need to be taken into consideration when preparing and responding to emergencies. And then, of course, health centers have that high priority to ensure that their patients can continue to receive the quality primary care that they're expecting during a disaster or an emergency. And so one thing that we really focused on is that plans are only as good as the assumptions on which they're based. And so it's really derived on knowing that your staff is well trained and having them actually practice in anticipation of events, hazards, and disasters, and how they would be responding in that capacity. So health centers are really only prepared as their staff are. And knowing that all staff, regardless of their role, their discipline or skill level, must have that same basic knowledge in order to support the emergency response. And so out of this thought, we developed these minimum competencies, 5 competencies that you'll see in the resources at the end of the slide deck that can provide both clinical and non-clinical staff the training and baseline competence for responding to emergencies and disasters, and that allows them to function in this altered care environment while maintaining the safety of their patients and of themselves, and also knowing how they and their health center fit into the larger picture of the community. So we know that better integration of health centers within that larger healthcare infrastructure will ideally address communication and resources, the allocation gaps among public health and emergency management, hospitals, and healthcare partners that in many cases, health centers have a little bit of a disadvantage in knowing exactly where they are in that big picture. So going on to the next slide, again, kind of what is the benefit of having these minimum competencies across health centers? When our staff are prepared, they are able to be more resilient in their roles and within their own personal capacity to respond. So for example, when staff can demonstrate a knowledge of their own personal health and safety measures that will be implemented during a disaster or public health emergency prior to that event taking place, they will feel more confident that their personal needs are being met and therefore can show up in their professional capacity to deliver and be present in a meaningful way. It doesn't kind of put them at odds with what they might feel they need to do to care for their personal family or their direct community that they're living in. So for example, when the health center staff understand that their health and safety and security risks might be that they will be affected while performing their duties in an emergency. Having them know that in advance is deeply empowering so that they are able to be mentally, emotionally, and clinically prepared. When staff are aware of the ways to minimize the potentially harmful effects these risks could have on their health and safety, it gives them that plan of action and that understanding where to draw from their resources in order to respond appropriately. And then, of course, as Amy was mentioning as well, understanding how to identify and address those stress responses, that vicarious trauma that might be arising within themselves or within their community, helps them to be able to be more responsive, not as much reactive, but able to usher wellness through this whole process. So as we were kind of developing these competencies and looking at some of the structures that are in place and other professional association trainings for emergency preparedness and response, a lot of what we saw was a provider down kind of hierarchy where the primary care providers are really kind of focused on being in charge to lead the preparation for their teams. And that they're, in many cases, the driver of the clinical thinking and the big picture response. And as we know, community health workers and lookalikes really lead the way in kind of leveling the hierarchy and care delivery, as well as addressing patient health needs. And so it makes sense that we would also see that as a need and as an important aspect for emergency preparedness and response and recovery. So going ahead to the next slide, when we are looking at the big picture, again, kind of alluding to what Amy was talking about earlier, roles of health centers will vary by community, and they should ideally be integrated as integrated into the response of a community. So what does that mean to be part of an integrated response? Mostly that there's partnerships established and that we would be identifying how is the health center working together in a common response and coordinating their actions to meet the needs of the broader community. Are there relationships that are being built in advance of an emergency or disaster? And how often are those relationships being fortified by working together in planning and training and exercises within organizations, and for example, with our PCAs or our HCCNs, and also within the community at large, with public health administrators, with hospitals in the community, that kind of thing. Also, roles should be based on the capabilities and the resources, the resource capacity of the health centers, and that should be known in advance. And of course, that will vary across health centers and perhaps even within the same organization. And also a health center may have agreements or MOUs, these types of things established. And it's important to understand how would those be impacted when there is an event or some type of incident that needs an urgent response. And these may be informal or formal MOUs or agreements. So that's one area that a health center would really want to take into consideration. So moving on to the next slide, these are just some considerations for all staff readiness. So this would be also inclusive of all hazards. These are some things that your staff really need a minimum awareness of and an understanding of their position in regards to these things. So what is your all hazards emergency operation procedure or plan? Is there an organization specific incident command center structure? And how are the staff assigned to be within that structure? Do they have leadership roles that are changing? And who will be reporting to them? Is the top hazard that the health center may be experiencing known? And do the staff understand how, excuse me, how to respond to those top hazards? Also important is, part of the staff understanding is how do we identify what these top hazards are? Who's making that decision? What are the hazard vulnerabilities that are being discussed? And are there some that may not be known? And that's a great place for example, the community health worker perspective to be brought in. What are we seeing in the community that we may not be aware of within the health center itself? And then, for example, understanding the policy for reporting incidents. What are those policies? Where are those located? Are staff aware of trainings that are coming up and what the expectation is for them to participate in those trainings? Why is it important? I mean, these are this is essential that staff understand that urgent emergency preparedness isn't sort of a one-time box that you're checking off, but a continuum of preparation and planning. And also, do we need to have a space where questions could be delivered for emergency preparedness? Do staff understand where to ask those questions or express those concerns about anything related to the health center in regards to emergency management planning? And then on the next slide, we can look at some of the ways in which staff might need to be either trained or just given that minimum competency of how their roles might change. And that also might equal changes in their responsibility. Will they understand that on one day pre-disaster, you have this chain of command, and on the next day, that might be changing. Who's reporting up or down to whom? What needs to be reported? Are all staff aware of what reports they may be receiving and how to respond to those? And it's very easy to kind of review this once when you're onboarding somebody, but it's a dynamic experience. So we have staff leaving, coming, we have new strengths being developed, people get in and get promoted. And so revisiting these roles and how their responsibilities may change is very important. Going on to the next slide, we just are reiterating here that really is a stressful time for folks and that practice makes perfect. So having those, trained staff equals successful emergency management response and recovery, and building that time into the health center trainings and building those relationships in the community is essential. On the next slide, you can see that participation in trainings and exercises are the key to building those skills. Health center staff need to be prepared to perform their assigned tasks at the moment of the response to the emergency. And we want to be training so that health center workers feel capable and ready to respond, and that prepared staff are making responsive recovery actions that are more efficient and effective. The next slide is looking a little bit more at training and how it's especially important to support health center members that may be assigned to perform their new normal duties in different ways or in different locations. Maybe they're in parking lots or they're embedded in a shelter. What are the tasks that are outside of their normal responsibilities? And then really, really importantly is giving folks that hands-on practice. So this comes naturally. And then last slide is just, again, trained staff equals successful emergency management response and recovery. The exercises that are required for emergency preparedness are really essential. We have to know what our role is, and that is essentially practice in those tabletop exercises, in those exercises that allow us to have a low risk environment, which we can look at how people respond and evaluate that. So I will pass it back to our moderators, Monica and Matt, and please feel free to ask any questions. Thank you so much.
Thank you, Jillian. Thank you, Amy, for your presentations. We will now move on to the Q&A portion of the session. Feel free to drop your questions in the chat, and we will answer them. And I already see a few. So Jillian, from Bob Burns at the NCHPH, it says, given the preparedness and response members of the healthcare team and their families are also impacted by disaster in their communities, do you have any tips on how to ensure that families of care team members are supported so that the care team members are available to work at the health center and assist the community?
Yeah, that's one of the pieces of planning that may not always get the attention that, for example, what do we do when we lose power at a health center, those types of activities or conversations are often had more regularly, but what is your personal plan? Do we have a plan in place for your pets? Do you have a plan in place for your children, your family? These types of conversations aren't as frequently involved in the emergency preparedness conversations, but they are part of our competency suggestions, is that all staff need to be able to demonstrate that they have a personal understanding of how they will be able to respond with caring for their own private life, basically. That, not to say like, I expect you to get to work in an emergency, because that is very difficult for, I think, any employer to say. But essentially, we want to be able to step back and say, we understand how critical it is for our staff to be available. Let's realistically look at that feasibility. Are some people going to be stranded because they drive an hour and it's terrain that may be snowy? Do we know that these staff members have 4 young children at home, and that may make it difficult? So having all that discussion in advance is really important. But there are, safety plans, individual health plans, these types of things. There's actually a lot of resources available, even through the government. They have personal preparedness planning for emergency response. But that would be part of a health center's responsibilities, to have those conversations with their staff, especially if they're asking staff to come in during an emergency event.
Thank you. It looks like Rodney Hummer suggests, I really like promoting the Red Cross Ready in 3 plan. Helps health workers, ensure that they have a good plan for their family. So again, that's a Ready in 3 plan, if you look that up. Jillian, one more question, then we have a question for Amy. Jillian, another question. Do your tabletop exercises involve community partners, examples, housing, transportation, EMS, etc.?
They can. And if that seems relevant to your health center, where it's located, and the hazards that your health center might be at an elevated risk to, or for, yes. Tabletop exercises, in many cases for health centers, end up kind of being during their annual retreat, and they bring everybody together and they're trying to do these emergency preparedness exercises. But building those community relationships and having those kind of mock responses across agencies is important, and particularly in larger municipalities, it's expected. So yes.
Great. All right, I'm gonna popcorn it over to Amy. Amy, we have some questions for you. Amy, given that the preparedness and response workers and their families are also impacted by this, did I read the wrong one to Jillian? No, that's right. Am I reading the right one? Yes, it's Amy, given the preparedness response workers and their families are also impacted by disasters in the communities, do you have any tips on how to ensure that families of CHWs are supported so the CHW members and their families can assist others? Sorry, Bob tricked me up there. I thought it was the same question over again.
No worries, no worries. And I think that is a great question, because when we're talking about community health workers and their impacts in their communities, their families are also greatly impacted. And so one of the tips that I have, it really goes back to what Jillian's talking about, is having those conversations with your supervisor, being very transparent about your needs in your community as you're being a helping in the helping profession. And that can be very challenging when you want to be seen as somebody who is a helper, right? And so from the perspective that I have, is that it's really on the supervisor to create those plans with their community health worker and have those conversations, have the comfort and create an environment where you can have those vulnerable conversations where the healthcare worker can come and be completely vulnerable about their own needs. And so I think the other pieces too, it really goes back to how we train our supervisors, which I think, again, becomes so critical on the other side of supporting the healthcare centers and these community-based organizations, that they need to have those tools. They need to have that additional training around creating safety plans, creating those disaster preparedness responses, that it's not just in the boardroom where we're coming up with all of our procedures and our policies, but it's really in those one-to-ones. It's in the group setting with your workers, and just having very transparent conversations about how are we going to approach this, knowing we each have families that we have to attend to. And sometimes these natural disasters are happening to us in the moment.
Yes, thank you. You also have Amy, your trainings and apprenticeship programs in Florida sound great. What is available in other states? Is there any movement or establishing a national curriculum or certification standard for CHWs?
Yeah, so
Can
that is a
can you solve that problem now? Yeah.
No, the problem is not solved. This is an ongoing conversation. What I can tell you is we are one of over 80 grantees on this program. There are some really great programs happening across the country. And one of the things that I can do is I can get with Monica and get a list out so that we can share with everyone about the different CHU-TIP programs that are going on. As far as a national curriculum and certification standard, oh, that is a hot button topic. There are a lot of differencing of opinion. And I want to be clear, when we talk about certification, certification is just one tool in the toolbox. It's not the end all be all to having an effective workforce. But we do have to recognize that with managed care and with insurance and billing, that is an expectation sometimes that people are registered or certified. And so again, there's lots of conversations. I would encourage everyone to go check out NACHWA and see what they are saying, which is the National Association of Community Health Workers, and also learn more about your own CHW association in your state, because they can provide a wealth of knowledge.
Great, thank you. We have time for about one or two more questions. Amy, this question is for you. Can you address the compensation of CHWs? Is there a CHW training curriculum for emergency preparedness and response?
Yes, absolutely. Compensation is another hot topic. And again, it varies from state to state. One of the things that I can say is that at MHP Salud, as a 68% CHW-led organization, it is at the heart of us ensuring that we are providing a livable wage, not only a livable wage, but also benefits and access to healthcare. So each state is different, each organization is different. That is one of the things that I think that when we start talking about leveraging community health workers, individuals with lived experience, we really need to be having those robust conversations about financial sustainability of that staff. In regards to the curriculum in our expanded apprenticeship curriculum, yes, we dive headfirst into disaster preparedness and emergency responding. And again, we touch on it a little bit within the core curriculum for Florida. Now, if you go to another state, other states have a more robust expectation for that core. And Florida is looking like it might be moving in that direction. There's whispers. But again, within the 144-hour curriculum, that is a central point to the training component.
Great, thank you. I think we have one or two more questions, but we'll have to. I see Ralph has a question, but we can answer that directly, maybe through email or whatnot. But thank you everybody for your great questions, and thank you again, Jillian and Amy. And we're going to now move on to the Mentimeter portion of the presentation. So let's do this. So if you want to join us on Mentimeter, you can help us answer these questions. These questions are really important for us. We're evaluating what we're going to be doing in our next forum for the next year. So please join us. Either go to the website and put in 4154-6773 or scan the QR code and follow the instructions. I'm going to give everybody maybe 10, 15 more seconds to do that. All right, everybody's thumbs it up. Good. All right, we got a bunch of people hopping in. All right. Give it 5 more seconds to slow down. Okay, next slide. All right, here's the first question, guys. What is the most valuable takeaway from this series for you or your organization? Again, we've had this is a 4-part series. So if you could put in your response, we will kind of open-ended question. Vector born, we have vector born. Great. Can everybody see the screen? It's working for everybody. It's all good. Awesome. Additional training. Start considering how my staff feel about their role during emergency. Allow more questions. Workforce and community supports. CHW certification. CHW information overall. Vector born, I found very interesting. Staff training and competencies. To remain resilient. Focusing and developing on building upon community partnerships. That's across the board. Additional training available, education to staff. Great. It's essential to be prepared as a CHC and CHW role, and CHW to have a role in this, correct. And the broad skill set of CHW is in the workforce and the ability to continue making, continue with more training. Yeah, CHWs are a very powerful tool and great for CHC. All right, we're going to go to the next question. Thank you for your feedback, everyone. Just a quick survey. Which of our previous sessions did you attend? Which of our previous sessions did you attend? We had session 1, public health emergencies and infectious and vector-borne diseases. Session 2, natural disasters. Session 3, extreme heat and wildfires. They were all amazing sessions. Pretty spaced out, so dig deep into your memory to try to remember. I know I attended all of these. Got a large portion of people in the first session, which is expected. We do now have tend to trickle down as you the tend to trickle off as you move on to into any kind of learning collaborative or forum, but it's good to see that most of you were at all of them. Great, guys. Thank you for your responses. And the next question. In a few words, what is your organization's biggest challenge in regards to emergency preparedness and response? It's open-ended question, so just pop in the question and I'll pop on the screen. Pop in your answer and I'll pop on the screen. In a few words, what is your organization's biggest challenge in regards to emergency preparedness and response? Time. That's the biggest challenge in life. I get it, but definitely within the workforce and when trying to assign, sometimes more work to already overstressed staff. Training, time, leadership commitment, staff turnover, resources, support. Yes, all of these silos, relevance, personnel. Awesome. Thank you, everybody. I'm just going to move on to the next question for time, but this is amazing, and we'll be sharing all this afterwards as well. And respond to these statements. My organization is adequately prepared, strongly disagree or strongly agree that your organization is adequately prepared to respond to the next public health emergency. My organization is adequately prepared to respond to the next natural disaster, or my organization has access to emergency preparedness resources needed to train and support staff. All right. Looks like we're falling in the middle here, which isn't terrible, which is great. Again. So, everyone seems middle of the road, which is not bad. And, that's better than I actually had expected. So Thank you for sharing. And again, we'll share all this information out. And then I think the final question is, my organization needs more training or support in these areas: infectious and vector-borne diseases, natural disasters, extreme heat and wildfires, workforce and community support, patients with access and functional needs, community partnerships, crisis communication plans, and other. Yes, workforce and community supports is not a surprise. We have a lot of workforce is the ongoing thing we hear about when we do our, fielding for about interest in trainings and things that health centers need. Crisis communication plan. Awesome. Thank you. Thank you everybody for responding. These are really going to help us in planning our next year. Thank you so much. And keep responding. I'm going to go to the next slide, but I'm pretty sure you can keep responding. So for everybody, we'll share these slides out at the end, but we have some resources and templates for health centers. Here's a bunch of NNCC resources. They're all hyperlinked, but we have all hazards competencies for health center staff. We have an operations template, a health center communications plan, and emergency preparedness tabletop exercises. And then we had all the NTTAPs that participated in this forum have all shared their resources here. And again, we will share them out, not only here on the slides, but we will also share them out on our forum website, which I will share at the end. And here is our final slide and our page. But to view the resources that we have all shared and all the resources from the past sessions, please go to our Health Center Preparedness Response Forum session Google site, and we'll share that out as well. But the recordings, the resources, and anything else you might need will be on that site. And again, please take the evaluation at the end of the Zoom call. It helps us improve our activity. So when you sign off the Zoom, you'll be prompted to take an evaluation. Please take the evaluation, and it really helps us in planning and evaluating our sessions. Thank you. And we were 3 minutes over. I'm so sorry, but thank you so much. It was a great session. Thank you everybody for joining us. And you'll be hearing with us in a few days with the follow-up email with everything you need regarding this session and the previous sessions. Thank you and have a great day.